It is an exciting time to be a nurse. The nursing profession continues to grow and adapt to the ever-changing healthcare field. Come with me tonight as we celebrate the profession of nursing. Let's take a look at where we have been, where we are now, and where we are going. In the past, little girls such as myself dreamed of being the next Clara Barton or Florence Nightingale as we played with our nursing kits. We applauded them for paving the way for us. Gone are the days of nursing in the 1800s, when not only were they expected to care for an entire ward of patients, but they were to daily sweep and mop the floors, bring in enough coal to keep the hospital heated, trim the wicks of their oil lamps and keep their oil lamps full, and they even had to make their own pens by whittling the nubs of the quill to their desired point. They carried out doctor's orders without question. They were not allowed to smoke. They could not drink alcohol. They were discouraged from going to dancing salons, and you were not even to go to a hair salon to get your hair done. If you did these things, your reputation was suspect, and you could be dismissed as a nurse. When I graduated from nursing school in 1980, we were using these multicolored ink pens to write our nurses' notes on. We used black for day shift, we used green for evening shift, and we used red ink for night shift. Our uniforms were all white nurses' uniforms, and some of us still had to wear white pantyhose. Our shoes were white nursing shoes or white tennis shoes. Some of us still even wore our nursing caps. When I would care for a patient, I would give them information about whatever I was doing with them, such as changing their bandage or changing their IV, but when they asked for more detailed information about their health and what was happening or going on, I always had to refer them to talk to their doctor. However, you could smoke, and we did so on our break room on our breaks. Here I am 35 years later. I do all of my nursing documentation with a computer. Our uniforms now are mainly scrubs, and those white tennis shoes, I've traded them in for hot pink shoes that I now wear to work. The nicest thing, though, I can say in this 35-year time is I am now more part of a team. I am active in educating my patients about what is going on with them, about their disease and diagnosis, and the doctor and I do that together and corroborate together. However, we have come full circle on that smoking thing. We are no longer allowed to smoke on hospital grounds. If we do so, it could be subject to discipline and we could even be dismissed. I could go on and talk for a long time about all the changes I have seen in my 35 years, but let's focus now on where we are going. According to a recent report published by the Institute of Medicine on the future of the nursing profession, they have the following to say. Nurses are going to have a critical role in the future of healthcare in our country, especially in producing safe, quality care and coverage for all patients in our healthcare system. The report further states that nurses should be full partners with the physicians and other health professionals in redesigning healthcare in the United States. Yes, it is an exciting time to be a nurse. We have accomplished a lot and we have much more to accomplish. So let's celebrate the profession of nursing, where we have been, where we are now, and where we are going. Thank you.